Hello. Hi. Sorry about that. There was just a little bit of technical difficulties. Can everyone hear and see me? Someone can just type in the chat box. Okay, fantastic, great. Thank you so much for being so patient. Without further ado, let's get started. So Good evening, everyone. My name is Samah. I am a Foundation Year 2 doctor working in South London. Thank you so much for joining us and welcome to the Mind with Leaf Journal Club series. So I'm going to share my screen now. And can you see what I'm sharing? Okay, let me try. You can't see my screen. Okay, let's try. Apologies, that's Can you see a presentation, the Journal Club series presentation that I'm showing right now? Can you see a screen? Oh, it's inside of. Oh, right. Okay, now I got it. I'm just gonna open the presentation and I might be flipping back and forth just to check if there's any questions. Yeah, let's get started. Okay, all right. So thank you so much for joining me, and thank you for taking the time to fill out the registration poll with the details that all of you have provided. We've had a lot of great input, which we'll be using in the series to help you get the most out of it. So from what I can see from the poll results, some of you have mentioned that you've attended and presented in journal clubs in the past, but quite a few others have never been involved and would like to learn more about it. So this is what this introductory webinar will cover. Also, yes, the chat box is available to you. If you have any questions, please feel free to ask in the chat box, and I'll do my best to answer them. And I'll make this session as interactive as I can. Okay? Okay, so in the agenda for today, I'm going to start with a quick introduction covering the benefits of active and passive participation. And next I'll move on to the flowchart. So this will cover the constituents of in every journal club presentation. And then I'll go through each individual constituent and provide an example to help solidify the concept. The last section of any journal club presentation is the critical appraisal. It's really essential, which is why it has its own section in the agenda, and as well as a checklist, which I'll be explaining later. I'll also cover some quick tips with you when you're making your presentations, whether it be for the competition, or work, or both. And lastly, I'll go over the details of our competition, which is open for everyone to join in on. I did want to mention quickly that in the poll, we had a lot of different topics that people wanted to see or present. So for this reason, for the competition, you're free to choose your own topic, but more on that later. Let's cover the basics first. Okay, so what is Journal Club? Journal Club are regular meetings in which healthcare professionals discuss and review research articles. So a presenter would pick an article for their presentation and send it out to their colleagues ahead of time. This would give everyone a chance to read through the article and have an idea of what the topic will be ahead of time. It also gives them the opportunity to come up with questions or points to discuss after the presentation, which is what Journal Club is all about. So the article is critically evaluated and it helps people to stay up to date on the latest research. Just wanted to double check questions before. Is this session recorded? Yes, it will be. Yeah. Right. So, as you can see, there are many different benefits to getting involved with journal clubs as an active or passive participant. So I'm just going to read through them. So the first one is it encourages critical thinking and analysis of research. It also helps to improve knowledge and understanding of current research as well as best practices. It also provides an opportunity for peer review and feedback on research. So peer review is something that is often used in the process of scholarly publishing, and it's used to assess research before its actual publication. For the second last point, it enhances communication and collaboration among healthcare professionals, but it also helps to identify gaps in current knowledge and research needs. And of course, for any of you who are in training, it will help you to build your e-portfolio for training applications to give you a bit of an edge. It also helps you to stay up to date on the latest advancements in medicine when you're working on your day-to-day specialties. Okay, so now we're getting to the Journal Club Flowchart. So this is basically the 5 constituents of any Journal Club presentation. So your presentation is going to start with a clinical encounter. So this may be a case that you've seen on the wards, obviously taken with the permission and ensuring patient confidentiality. So you have to make sure that the patient information is confidential and you have their permission to share it in the Journal Club. And when you're presenting it, make sure you keep it brief and to the point. So after the clinical encounter, you have to display the clinical question. So based on the clinical encounter you had, what gap of knowledge have you identified that you're now trying to answer in your presentation? Oftentimes, the format of the clinical question follows the mnemonic PICO. You may or may not have come across this in the past, but just out of curiosity, how many of you are familiar with PICO? Has anyone heard of PICO before? Okay. Oh, I was asking if you've ever heard of the mnemonic PICO, P-I-C-O. No worries at all. No worries at all. I'm going to cover it now, but I was just curious to see if it's something that a lot of you have heard of before. So it's just a bit of mixed answers. No worries at all. So PICO is a mnemonic where that you basically use in order to create your clinical question. So I'm just going to go ahead and talk about what each one stands for. So the P stands for a population, a patient, or problem. So what is it exactly that you're looking into? What cohort is involved? You must be specific. That's P. So next is I. I is intervention or indication. What is it in particular that you're considering? This can be a medication, a procedure, or a scoring criteria. C stands for comparison or control. So what are you comparing those above? So what are you comparing with against the intervention or the indicator group? So if your I is an intervention, for example, let's say a medication or given condition, C can be a control group. And I feel like this would start to make more sense as we go through an example. And lastly, for O stands for outcome. So here, you're trying to state what you're trying to accomplish. What is the end goal? Just want to double check before we continue if everyone is clear on that. Does that make sense? Very good. Fantastic. All right. So what I have here is a clinical encounter, just to give you a bit of an example, and we're going to work through a PICO format for this clinical encounter in the next slide. Okay, so I'm just going to read it out loud. So Mr. JD is a 55-year-old man. He has persistent uncontrolled hypertension despite taking his medications regularly as prescribed. His past medical history is significant for hypertension, which was diagnosed 5 years ago. In terms of medications, he takes 5 milligrams of amlodipine every day. In the past week, 2 of his blood pressure readings were noted to be 150/90, as well as 165/94. He's concerned that his blood pressure readings have been high, despite being fully compliant with his medication and implementing the recommended lifestyle modifications. So at this point, you're considering making a change in terms of his medications. And 2 of the options that you're thinking about is possibly increasing the amlodipine dose or trying a combination therapy with a beta blocker. Okay, so let's try to do a PICO for this, and I'm going to ask you guys to come up with these. So I'm sorry, I'm just going to have to go a little bit back and forth. But for P, population or patient or problem, what would you put for that one as an example? So based on the clinical encounter that we had, okay, 57-year-old male, elderly, okay, very good. Male with hypertension above 55. Yes, yes, excellent. Very good, very good. So, exactly. So you could say in adult patients with hypertension. You can make it as specific or as general as you want. The more specific, the better. So yeah. For I is intervention. So what intervention are we specifically trying to implement here? Yes, uncontrolled hypertension. Very good. Yeah. You have to be a little bit more specific. So in this case, you want to see if you should try to increase try a combination therapy of a calcium channel blocker, which is the amlodipine, with a beta blocker. That's the intervention. The comparison or the control group, in this case, we're doing a comparison because we're increasing his amlodipine. That's what we would put for C. You want to see if it's effective in increasing the blood pressure. And the outcome is basically measured by a reduction in blood pressure levels. Okay. So this basically gives you the format for your clinical question that you're going to use in your journal club presentation. So through your career, you're going to come across countless encounters, and you'll find that not every single clinical question pertains to therapy. Sometimes it can be used to answer all sorts of things, and here's a table to show that. Okay, so clinical questions can pertain to therapy, etiology, diagnosis, prevention, prognosis, meaning quality improvement costs. There's a lot of things that you can have clinical questions for. And for each one, there's an appropriate study or research design that's correlated with it. There can be more than one appropriate study design for a given clinical question. But as you can see here, the bolded ones are the ones that are usually the best for that given clinical question. And in your own research, you can look tables up like these, which can help guide you. Can anyone tell me, based on the example that we've had, so this is our PICO, just to help refresh your memory, based on our clinical question, do you know what we're looking for in terms of a suggested research design? But first of all, what type of clinical question is it? What are we looking for? Is it a therapy, etiology, diagnosis? What are we looking for? Therapy. Yes, very good. Exactly, therapy. So based on that, we would want to do a systematic review, a randomized control trial, or a meta-analysis. Yeah, so we can use one of those. So what I have here is what is known as a hierarchy of evidence. So there's different types of studies that are out there, and they're put here on different levels. And the levels are assigned to studies based on the design, the quality of the study, and applicability to patient care. So the higher levels of evidence have less risk of bias, and you can always refer to this as well during your literature search. So the higher you go on the pyramid, the stronger the type of study that it is. Okay. So I've been talking a little bit about literature search. So what do I mean by that? This is basically where you start to look for the article that you're going to include in your journal club. So there's a few steps when you're doing a literature search. You can start by defining some keywords related to your case. So general things, you can use it from your clinical question, you can use it from your encounter, and you use these words in the databases. So based on our case from Mr. JD, what are some keywords do you think that are related to the case you can use to look up articles that are related to it? What are some keywords? So a few of you were mentioning it earlier. You can use those words as well. Hypertension, yes, very good. What else? Very good. Think about the intervention that we're talking about, or the comparison, the words that we used in the PICO question. Amlodipine, yes, very good, excellent. What else? Control hypertension. You're more specific here, which is good. Combination therapy, yes, exactly, very good. Beta blocker, really good, really good. Yes, exactly. Amlodipine plus beta blocker, yes, yes. So all of these words, you can put them, plug them with commas in the middle in the databases, which I'm going to show you, in order to find articles that are specifically pertaining to your case. Okay. So, and there's different databases that are available. Some of these may look familiar. So you find your keywords, you find a database, you plug those keywords in the database, and you click search. What comes up next is probably a very, very large list of articles. So what you can do is you can apply filters and limits to reduce that list to find the best article for your clinical question. So there's different filters that you can apply. Some of them can be things like publication date. So maybe you want to take a look at articles that were only published in the past year, or past 5 years, maybe even 10 years. And you can also look at the type of study that you want. So you want to take a look at just randomized control trials, case control studies, cross-sectional studies, so on and so forth. You put those filters, you'll come to a few articles, and you have a read through it, basically. From there, you can pick whichever one is the best one, and you can evaluate the quality of it using a critical appraisal, right? And I'll talk about that later. Okay. So now I'm going to show you how that works with our example. So for our database, I selected PubMed, and these are the keywords that I put in, exactly like we've mentioned before: monotherapy, combination therapy, antihypertensives, amlodipine, bisoprolol. You can put it in any way that you want. This is a keywords. And in terms of filters and limits, I wanted to take a look at randomized control trials because as we were taking a look before in the different types of study designs, the randomized control trials are the best studies suited for the clinical question that we have. And initially, I put it in the last year because I wanted the most up to date, but unfortunately, it didn't give me a lot of articles. So I said in the last 5 years, and I came across a few. So I went through these articles, and I found this one, which I felt was very, very good. Oh, sorry. So I found this article. Apologies, I just want to cover a couple of points before we continue. Just in regards to choosing your article, okay? Firstly, you have to pick a primary research paper. This will make the process of doing a critical appraisal much more straightforward. You have to pick a topic that you're interested in. It will show in the work that you put into it, and it will make the process much more enjoyable for you. Next is knowing your audience. So there are many of you from different specialties. So if you're, for example, in AMU, it would make sense to pick a topic in adult medicine. If you're in urology, pick a topic within that specialty to make the most out of the teaching session. It will also help to get a very stimulating discussion going after your presentation. 4 and 5 tend to go hand in hand. So pick a journal article with good quality and make sure that the impact of the journal apologies, can play a role in that. Not always, but in most cases. Does anyone know what I'm referring to when I say the impact factor of a journal article? It's okay if you're not sure. It's okay. How good the source is. Yeah, yes, exactly. It's an indicator of how good the source is. Yes, yes, exactly. Yes. It's basically the frequency with which an average article, an average journal has been cited in a particular time frame. So influence on the society, yes, yes. I'll give an example of this. So there is a journal known as Nature. Nature is one of the world's most cited scientific journals with an impact factor of 64.8. So the impact factor is a value, and what it represents is the total number of citations for a given journal, for example, like Nature, over the past 2 years, divided by the total number of publications within the same period. So the more citations there are compared to the number of publications, the more impact a journal has. So when you find an article published in a database, it will often show you which journal it was published in, and you can easily Google its impact factor. It can sometimes help if you have a couple of articles that you're debating on, and you're trying to find a tiebreaker, and you've gone through you've exhausted the list otherwise. You can definitely use the impact factor to help you. So when presenting, back to our example, when presenting a case, this article is the one that is best suited for this question. It's a randomized controlled trial that compares the outcomes of 2 groups. So the first one is up titration of amlodipine, or using a low-dose combination therapy with amlodipine and bisoprolol. When you're showing this article in your presentation, you need to provide bibliographic details of the paper selected and state why this paper was chosen. For example, it was the most relevant, it was the most up-to-date, it had an adequate participant numbers, it had good methodology, or etc. So this is the part of the presentation where you cover each section of the paper, giving extra attention to things like methodology, results, discussion, and so on. If there is a table involved in the study, it would be a good idea to include a slide with this table, and you can use it as an opportunity to point out certain aspects of it and strengthen your critical appraisal. So for example, if a study is not exactly strong or if it's poor, You can say, for example, due to certain things, you can support that by saying, for example, if the sample size is too small, it can introduce bias, or if the p-values show that the results in a particular point were insignificant. If the study is missing those details, you can also use this point to prove that the opposite is true. So, for example, if the sample size is adequate, what the p-values are, and how the study contains internal validity. And I'll talk more about that later. Just a couple of points when you're presenting your article. Although in most cases it is set out, you can send it out ahead of time for the audience to read. It may not be fresh in their minds, so maybe not everyone has had a chance to read it. So when you're giving your presentation, make sure that you provide a brief background on the paper. That way you make sure that everyone is on the same page when you're starting out. Another thing to point out is that you shouldn't be afraid to question the paper. Sometimes a literature search may not yield the best results, and it could be that the clinical question is something that still needs more research. But this shouldn't deter you, from presenting the topics, given that there is still enough information to present. So all of this tends to fall under the category of critical appraisal. Sometimes, in cases like this, you can add some slides to your PowerPoint that cover how the article or research project can be improved. So there's some flexibility as to how it can be done. And you can talk about how the methods can be improved, or maybe that the sample needs to be larger in order to reduce the amount of bias it has. And lastly, another point to keep in mind in terms of the timing of the presentation is to keep each slide for about a minute on average. There are exceptions to this, but the point is to keep track of your time. Questions? Influence on the society. Sorry, in what terms influence on society? Oh yes, influence on the society. This was from before. Apologies if that was a question. Okay, great. So now we can get to the critical appraisal section. Let's say that you create a question, and during your literature search, you come across two articles that answer your question, but one of the outcomes, and the outcomes for both of them contradict the other. How can you tell which of the two reports is reliable and trustworthy? So this is where critical appraisal comes to play. So what exactly is it? Critical appraisal, it's the process of carefully and systematically examining research to judge its trustworthiness, its value, and relevance in a particular context. It assesses things like reliability, validity, and the clinical relevance of a particular research article. When it comes to research, unfortunately, not everything that is publicized is reliable or accurate. It can be prone to bias and can draw false conclusions. So I put a couple of points under Research A and Research B. You can see I've mentioned sample size and methodology, which I've touched on a little bit. So the reason that it's important to have a large sample size because it gives more power to the study. And in terms of methodology, if it's not done properly, it can introduce bias by its own means and draw out false conclusions. Right, and I'll cover that in a minute. So critical appraisal can have different subcategories, but those three tend to be the most popular or the main things, okay? So when I say reliability, it's things like, can the results be reproduced? Has the research been conducted in such a way as to minimize bias? Does the paper have internal validity? I'm going to cover the types of bias and ways to minimize it in the next slide. So the second point is validity. What does the study show? How close are the results to the truth? How well do these results apply to the population in the study? And is it applicable to the general population? For clinical relevance, it's things like, have all the important outcomes been considered? Have they looked at the potential benefits, consequences? Sometimes even the economic evaluation can be taken into consideration. So now I'm just going to touch on the reliability in the study, and this is going to focus mostly on the types of biases. So in a perfect world, research would be completely free from bias, but in a real world scenario, researchers have to do all they can to minimize it. Can anyone tell me what I mean when I say bias? What is bias? Can you give any definition as best as you can? Anonymous? Um, so bias is non-random error that leads to deviation in results from the truth. So basically, any trend that can lead to conclusions that are different from the truth, and one outcome is systematically favored over the other. There are different types of bias. The first is selection. This is when there is a non-random assignment of participants to a study group. And this is usually done so that one known outcome will occur. And oftentimes, the individual in the sample group may not be a realistic representation of the population from which the sample was from. So again, it's non-random. So here's a drawing that illustrates selection bias. Say someone made a product and advertised it claiming that it helps to build muscle, and their marketing shows that 90% of the people who have tried the product agree that it works. But let's say someone else does the research and their results show that it has a 90% failure rate. Which one can we believe? When we look into the individuals who were picked for the first research project, you might find that they were only bodybuilders within the intervention group, who may already have great muscle mass, and their success is due to their workouts and only diets. It's not exactly a sample that represents the population as a whole. Not everyone is a bodybuilder. In the second study, the sample is from both groups, and there's individuals are selected at random, and people from all walks of life are included. The sample is more representative of the population the study is meant to correlate with. So this study B would be a more reliable study because of the methods and the samples and how they've been randomized into those two different groups. Of course, there's different types of bias that are present. There's performance, detection, as well as attrition bias, and so on. So performance bias is unequal provision of care apart from treatment under evaluation. So this type of bias occurs as the study is progressing. So researchers, for example, may give more attention to one group compared to another. So from our example earlier with Mr. JB in the article, if the researchers were aware of whether a patient was receiving monotherapy or combination therapy, knowing the hypothesis, they may consciously or unconsciously try to sway the results in favor of the hypothesis. This is why often double-blinded studies tend to contain more validity. Next, we have detection bias. This is bias based on the outcome. So this is after a study has been conducted and the researchers are taking a look at the outcome. They may pay more attention to one study compared to the other. Attrition bias occurs when there's systematic differences between those two, those who complete a study and those who drop out or are lost to follow-up, especially if the reasons for attrition are related to the study outcomes. So there are a few ways to reduce bias, and we do this, of course, to increase and improve the reliability of a research study. This is a bit of a busy slide, but I'm just going to skim through it. The recording for this will be available, so you can definitely have a look back at this in more detail. But randomization is kind of what I was covering before, so assigning participants to treatment and control groups at random and giving them equal chance of being assigned to either group. Blinding is when you withhold information that could potentially influence study results. So you can blind the research participants, and there's something called double blinding, in which also the researchers are unsure of unsure of where the participants are in the study in terms of whether they're the intervention group or the control group. And also that's like similar to allocation concealment, something that's commonly used in randomized control trials to prevent selection bias, and they conceal the allocation sequence from principal researchers. Follow-up, this helps to reduce attrition bias, as I mentioned before, helps to identify any confounding variables, and enhances internal validity. There's also things like intention to treat analysis, as well as adequate sampling, which I've touched on a little bit. Okay, validity of a study. So in the critical appraisal process so far, we've covered the reliability of a study, types of bias, and how to minimize it. Now we have to cover the validity. So on the diagram is the right is the famous target illustration that's often used to help differentiate between reliability and validity. So imagine you're an archer, for example, and you've developed the skill to shoot arrows consistently just above the bullseye. And you can do this from anywhere. That's great, and that shows reliability in your methods, but the point is to get the bullseye, and that's the validity. It focuses on how close we are to the truth. Does the study actually answer the question that's being asked? How accurate is the measurement? And in research, our target is to make sure that we are the bottom right one. We want to get the most reliable and most valid research. So there is a section in critical appraisal that focuses on the relevance of the study to real-world healthcare. You've done all of this work, but how is it going to be beneficial if it isn't relevant or cannot be applied? This is where the research can have an impact on clinical decision-making, where it takes into account factors like adverse events, pros and cons, and perhaps even economic evaluation if it's a large investment. So, for example, if you're assessing the efficiency of robotic surgery versus laparotomy interventions for endometrial cancer, so that's just an example of something, of a study where you'd want to evaluate it economically. This is a lot of information to try to keep track of when you're critically appraising a journal article, and especially during a presentation, which is why there are tools out there, checklists to help simplify the process. Critical Appraisal Skills Program is one of them. They help to create many checklists for any given study design, which you can provide to the audience for the discussion aspect of Journal Club at the end, and you can make a verdict on each of these points. So last thing I wanted to mention before I talk about the competition is the quick tips. So it's important to keep your presentation under 30 minutes. Focus on the key points and allow time for discussion and questions. Okay, so now for the competition. So the series will run on a monthly basis. As I mentioned at the beginning of the presentation, we had a lot of different topics that people wanted to present or just listen into. So if you are interested in taking part in this competition, we will leave the topics up to you to decide on. So make a presentation, submit it to Mind the Bleed. We'll announce the winner on our page and invite a specialist from your topics field to help lead the discussion on the webinar. And individuals that are attending the session are also invited to, bring up points, discussions for the journal club presentation. So details on dates and when to submit your articles will be posted soon, so please keep an eye on that. But yeah, thank you so much for joining me on Mind the Beat today, and I hope you found this session to be extremely helpful. Don't forget to fill in the feedback forms and collect your certificates. Recording of this lecture will be available if you need to refer back. So just wanted to double check and see. Any factors, some answers to questions, any factors out of the PICO question that may influence the results? Yes, that's a very good point. Some papers are unlikely to have biases. As I mentioned before, it's really important to try and reduce the amount of biases that are in papers. but it's still the point of journal club is also to learn. So if you do find that there is an article out there that's extremely valid and extremely reliable, it's great to present as well because at the end of the day, you want to keep yourself as well as your colleagues up to date on the latest advancements. And this can also be helpful because it can help to update certain guidelines in hospitals and protocols. Which email do we send it to? I'll post all the details. It'll be available on Mind the Bleed. So there will be a section for Journal Club, and we'll put all the details there. So if you're interested in joining the competition, you're more than welcome to send it in, and we'll post all the dates and everything. So you're going to be aware of that. Thank you so much. Thank you for joining. Thank you for joining me today. Yes, of course. I'll send it now.